All right, we're back. So we are going live. We have been unable to connect to our private Facebook group. So we are going to have Hillary and Molly from our team. Thank you so much, Hillary and Molly, for supporting me through the tech glitches, to post the link for YouTube and LinkedIn to the Facebook group. And hopefully most of our friends who are joining us there can view the presentation today. So today is all about quantifying positive health outcomes, like how, when you are seeing patients, especially if they are referred to you, how do you track, measure, and then communicate your impact to other practitioners? I would say that like it's most important for when you are accepting referrals from like interdisciplinary teams, but it's also really important for your business. And, as we'll talk about a little bit today, you will see, how powerful it can be as a marketing tool as well. Often we're in the business to, our focus is to drive positive health outcomes and support people with changing their nutrition related behaviors. But having somebody meet their goal, while it is super satisfying for us as a practitioner, and of course for the patient and client, we're not always thinking to the next step. And I have to admit, like when I was in private practice, just like 9 years ago, I was on that path, like just bringing clients and patients in, really supporting them with behavior change, taking some measures, but really just happy to get people results, which is great. And that ultimately should be your focus. But documenting, in an anonymous way, it can be really, really powerful. And, in a HIPAA compliant way too, it's anonymous when you're collecting a lot of data, but you're going to definitely want to report back to any doctor, physician, or referring partner, like how that particular client is doing. And you're going to want to do that through your EHR. But today we're really talking about kind of bigger picture, like what's the data? What kinds of things can you measure? How can you measure them? And I am going to be doing a screen share today, which is, super helpful that we're on LinkedIn and YouTube, because I can do that. It's not necessarily the easiest thing inside of Facebook. So I'm actually going to make my screen a little bit bigger. I would love to hear from you. Where are you joining us from? So hopefully our Facebook group members have been able to join us excuse me, using the links on YouTube and LinkedIn. If not, we are recording this. So we'll make sure that you get all of this information to use in your practice. So quantifying positive outcomes, that's what we're talking about today. Because we're talking about reports and numbers and things like that, I thought it would be really helpful for me to just put together a really brief slide deck to guide the conversation so that I'm not just talking, but I'm also able to show. And I will be sharing the tools inside of Living Plate RX that can support you with identifying the data, collecting the data, and also reporting the data. So thank you, Molly, for joining us on YouTube. So Hillary is making sure that this link is being dropped to our members. So thank you so much, Hillary. It's really helpful. All right, I'm going to just advance a slide here and talk a little bit about what questions we're going to be answering today. So every time we do a live Q&A, we poll our Facebook group and ask them, what do you want to learn about this particular topic? So we pick the topic because we know enough about our community and enough about private practice, like what are the things that we need to learn about kind of at a high level, but then really, in practice, like how does this translate, and what do our practitioners need to understand on a deeper level to, help them with this particular topic. So questions that we're going to be answering today. Number one, how do I present outcomes to referral partners or other care providers? So kind of what does that look like? How do I translate, I feel better, or, everything is great, which is, of course, we love to hear, but how do I translate that into objective and measurable outcomes? And then also, how can I use outcomes to justify my pricing and improve my marketing moving forward? Oh, thank you, Molly. Thanks so much. And so we're actually going to be, the answers to these questions, it's kind of like addressing it all at once, because all of these questions are going to be answered, kind of going through how do you, what do you select to measure? How do you measure it? And then how do you present it? So, but we are going to be covering all of this. And it really is about proving your value, right? So why does this matter? Why does this matter? Why this matters is because you can't change what you can't measure ever, right? If you're looking to change, excuse me, somebody's health outcome, if you're looking to change their dietary behavior, you need to be able to understand where they're starting before they start working with you. That's how you measure your impact. And it really helps solidify your value, strengthen the referral relationships, right? So if you have a physician, a primary care physician who is referring to you, getting back to them with, the outcomes that they can measure, which is, oh, this client's blood sugar is much better under control. Yes. But what were all of the things that led up to that medical outcome, right? What were all of those kind of nutrition measures? And it really helps strengthen the referral relationship because you're documenting every step of the process and sharing that with your referring partner. It communicates your value clearly. This is like a really big one for me. Nutrition behavior is notoriously difficult to measure and it's difficult to quantify. That's why we're sharing these tools with you today. And it sometimes can be hard to communicate your value. And this helps do that. This helps drive value. And then elevates your profession with measurable impact. I promise you that what we're going to be sharing with you today, there aren't that many practitioners who are following these processes or are following this type of data collection and data reporting. You know who's doing it really well? The startup companies that you as a private practice practitioner are competing with. They're collecting data, they're reporting data in an anonymous way. You need to be able to do the same thing. And it's not as difficult as it might sound. So hang with me and I'm going to kind of walk you through that. Okay, and what we were showing there, let me just go back a little bit here. What I'm showing here are some of the reports that we're going to be taking a look at that help you quantify kind of the progress that the clients are making when they're in your care. So one of the things we're going to be talking about today is a referral outcomes report. I used to call these executive summaries, but I actually like the referral outcomes report better. I worked in ChatGPT a little bit over the weekend to kind of, wordsmith, executives. I mean, executive summary could be anything, right? So I really like a referral outcomes report. And this is specifically for those who refer to you. But like, as you're seeing at the bottom here, let's say you're running a corporate wellness program. That's what I created executive summaries for. I also created executive summaries for community programs. And I'm going to share with you a brief story here. One of our greatest partners when I was in private practice was the health department. They would allow us to host culinary nutrition events that were huge. I mean, huge. We're talking between, I don't know, anywhere from 60 to 100 people. We've had 100 people show up at a church, in a library for our culinary nutrition programs, which was great, right? Got a lot of referrals from that because we showed up and presented value. But the referring partner was thrilled. Like she was not expecting anything back from me. But after every event, I provided her with an executive summary. Now, the executive summary for that event looked a little bit different than a referral outcomes report, but it's the same idea. If someone is going to partner with you and they see value in partnering with you, you need to deliver back to them some kind of results report, right? And corporate wellness programs, that's a little bit more like a referral outcomes report because you are working closely with the corporation. They're going to want data, right? But it has to be anonymous data. You're not going to be reporting to human resources, somebody's private health information, but there are other measures that you can accrue over the course of a corporate wellness program that can show your impact. And, it's great for the person that you're partnering with because especially in a corporate wellness setting, they probably have to answer to leadership. So you're doing them a huge favor by providing them with that extra data. So a referral outcomes report really is just a structured summary. It's not like things went great. And we are going to talk about qualitative outcomes too, because that there is importance there. If everybody's happy and things go great, that's wonderful. But this is a structured summary that's going to communicate the results of care provided to clients referred by somebody else. So again, corporate wellness, but it could be like what you're seeing below. Physicians, so primary care specialists, primary care physicians, specialists like endocrinologists are wonderful, bariatric surgeons, women's health, really great referring partners for nutrition practitioners, therapists and mental health professionals. We actually have a growing group within our own membership of therapists and mental health professionals coming into our community for the content. Like, they need nutrition content. And that's a really special person who is trained in both nutrition and mental health and therapy. But those therapists and mental health professionals might not have nutrition training that you're serving, so they're going to come to you as the expert, right? So you need to report back to them. Physical therapists, chiropractors, excellent resources for referring partners. And again, we talked about community programs, various wellness partners like nonprofits, and corporate wellness programs. So really important to kind of step up and provide this referral outcomes report. You know what's funny? And I'm going to speak directly to my members right now, because I know what they're thinking. Where is this in the library? And Molly and Hillary are thinking the same thing. We actually don't have a referral outcomes report template for you, but guess what? Within the next few weeks, I'm going to take a look back at the executive summaries and reports that I used to create in private practice, take a look at those and recreate for you a template. So our members will be able to go into the library and access a referral outcomes report. And basically, you don't have to decide what data to collect. You just have to fill in the blanks, right? Using all of your other resources in Living Plate, which I'll show you. All right. I'm going to take a break here and share. Well, let's talk about the core components first, and then I'll do a screen share about kind of where you can find all of this different data. So there are 8 key components of a referral outcomes report. Number 1, the executive summary. I actually don't do that until I finish the report. So if you're doing, let's just use a program, for example, because you don't necessarily have to provide an entire report for one person, right? But let's say you're running a group program or you're doing a corporate wellness program. You are going to want to offer an executive summary. Do that after you fill in the report. I'm going to create 2 reports. We're going to do like the referral report for individual patients, and then we'll do a group one because they are going to be a little bit different. So for our members, just sit tight for a couple of weeks and we'll create those for you. But number 1 is this executive summary, which is just an overall snapshot of the outcomes, and then just like a thank you, like this was really successful, and you're going to see why now. Number 2, referral snapshot. So just numbers. If I did a community program or a corporate wellness program, how many people showed up? Right? So how many people registered and how many people showed up? What were the demographics of the people who attended? Sometimes you'll be able to collect that data. It might be a little bit softer, but if your referring partner is a women's health group, they're going to want to know, were there women that attended this group program? So that could be the importance of the demographics. It doesn't have to be super detailed, like age, but there are going to be some key components to the demographics that might be important to your partner. So just make sure that you include those. Number 3, care delivered. Like, what type of care did you provide? What was included in the session? Really just a summary. Now, this is a little trick, just like a little cheat sheet here. For the care delivered, you're basically going to go back to the proposal and just copy and paste that. Like, this is what we delivered. This is what we said we were going to deliver. And this is what we delivered. If it's for an individual, it's going to be, I promised you, primary care physician, that when you sent patients to me, we were going to collect an HEI score. They were going to do a dietary intake survey. We were going to provide them with recipes, cooking videos, meal plans, all of that. So whatever the care delivered really is your program or your package, whatever kind of structure you that really the client experience, right? So the patient or the client experience, that's the care delivered. So not a whole lot of work to do there. Outcomes summary, we're going to be talking they're really going to be focusing on behavior change, satisfaction, goal setting, goal progress. For the quantitative, if you're a Living Plate RX member, you're going to be able to get that HEI score, which is an evidence-based healthy eating index score from the USDA. You're going to be able to grab that number. So that's going to be really important. But there are other quantitative measures, which I'm going to show you shortly, that you are going to be able to see. Molly, if you could just type in a note here and let me know, just confirm that you can see and hear me okay. Should have done that at the beginning, but just want to make sure everybody's able to kind of see the slides here. Okay, so number 5 would be collaborative notes. Now, this is where, mostly for individuals, if you, within your EHR, you have notes from the physician, you've kept notes from yourself, so you can provide a summary there. If you're doing a group program, you may or may not need to include this, but if you did some collaborative efforts, if you had some communication during the program, then you can just throw them in here. Number 6, Molly, you're going to love this, case studies. We just hosted a strategy session for our members all about how do you create an I'm just going to say anonymous. I can't even get this word out. I'm sorry. Anonymized story. And how do you do that and illustrate your impact? So how do you create an anonymous report that doesn't identify a particular patient, but does use that data from a particular patient to kind of make the case? Like, this person came to me in this state with these measures, and we went from here to here, right? So that's going to include something as simple as their HEI score. They went from 55 to 70, right, in a period of 3 months, that kind of thing. So you're going to create these case studies, really important to include in reports. Case studies are key, and they can be used for marketing as well, which is really helpful. And I'm just going to hide my face here so you can see the bottom 2. So number 7 is opportunities and recommendations. So once you kind of dump your data into this report, you're going to see trends, right? So you want to note those here. And you're going to want to note if there were any ideas for improvement. You know, let's say you're measuring somebody's confidence and the confidence wasn't quite where you wanted it to be. I'm going to give you an example. It's not really relevant to the way that I practice, because I always included culinary support, like recipes, meal plans, cooking demos in my care. But let's say you run a program that is nutrition education only. And one of the questions might be on the exit survey, on a scale of 1 to 10, we're going to talk about Likert scales in a minute, but on a scale of 1 to 10, how confident are you that you are able to make meals supportive of your PCOS diagnosis, for example? You know, if they answer a 3, like, you know, okay, but not great, like you really want them at a 5, right? That could be an area for improvement. So if scores come back and they're not perfect, which they'll never be perfect, there's the wonderful thing about collecting the right kind of data in the right kind of way is that you're always going to be able to see an opportunity for improvement. And that's really what you're talking about here. So go back, take a look at your data, and understand how can we improve this. So the next time we do nutrition education, I really want to include a cooking demonstration. I really want to include some cooking videos. I want to distribute some meal plans, things like that. So always look for those opportunities to improve, so that, you know, always be thinking about the next job, right? The next opportunity for you. And then lastly, just conclusions and wrap up and follow up. And then your contact information. I always included my headshot and my bio I include it in every proposal. I would include it in every executive summary and referral report, just so that they can, you know, these, especially the primary care physicians, they work with a lot of people. So if you send, you know, a summary back to the physician, they're going to be required to put that into the patient's chart, because that is a medical report that you're delivering back to them. And that they'll keep it, and, you know, you'll be forever associated with that client or that patient, which is really great. All right. So before we move forward, so we are going to talk about the quantitative outcomes that you can track. And so you can see here, I've listed out a bunch. I want to take you on the inside of Living Plate RX and show you what they actually look like. So let's go ahead. I am going to share my screen. I'm going to share this tab instead. Great. Looks like that was successful. Okay. Oh, and by the way, if for our members or our frequent flyers who come to these Q&As often, you'll notice I'm in a different setting. I was locked out of my office this morning. I couldn't get in, so I showed up for our live Q&A. I could not get into my office. something happened with the electronic door and I didn't have my key. And so I'm in my home office today. So I just noticed that I didn't share that with you. Not that it's important, but hey, I like to share. Okay, so quantifying positive health outcomes. Now I'm going to be taking you into Living PlateRx to show you what these look like. So the first thing that I want to show you, which let me just share this tab again. All right. So we have the HEI scores. There is so much here. So it's better to show you than to talk you through it. So let's go to the meal planner here. And as a Living PlateRx member, you have access to an extensive library, which is right here. Right, lots of content here for you to dive into to use in your practice, but you also have access to the best in the business meal planner. And that's what we're going to look at now. Really, before you issue anyone. Oh, okay. Molly, just can you make sure that am I still live? I'm getting a message that I've lost a connection. So just make sure that everybody can still see my screen here. All right, I'm going to share the meal planner side of it now. Before you issue a meal plan, before you send anybody a recipe, before you create any kind of intervention, you need to have some data at the very, very beginning. Where are they starting on the beginning of their journey? And the HEI score, this healthy eating index, which we have talked about a ton in the past 3 months. So if you're new to our community, you can look back on LinkedIn, you can look back on YouTube, within the Facebook group, we have all of them posted there. But all of the education that we've done around the healthy eating index score is available to you. So if you want that, drop us a note here. We'll send it along to you. We'll send you some links. Or again, you can join our private Facebook group and you can view the recordings there. If you're a member, it's in your library. But we've had a lot of conversations about the HEI score because it's really important. It is one of the most important and profound ways that you can identify what somebody's 90-day eating pattern is before they walk into your office, which is super cool, right? So before you get on that Zoom or before you engage someone in a counseling session, how are you going to know what their 90-day dietary behavior was, their pattern was? You could do a dietary recall. You could issue, which could be 3 days or a week. You could do an FFQ, which is evidence-based and great, but very laborious, or you can issue them a BioScreen dietary assessment tool, which is super easy to do. So that's where we are right now. We're looking at the BioScreen tool. Just hold on one second. I just want to make sure. There we go. Okay. Here is BioScreen. Now, when you issue a BioScreen report, it's really simple in Living PlateRx. You just issue first name, last name, email. You send it to them. Your client and your patient is going to see a series of pictures, and they basically answer questions based on the pictures. So it's very visual. It's really fun, super easy. At the end of 20 to 30 minutes, you're going to get reports back. These reports are golden. You're seeing them all here. I'm not going to show them all to you. Our members get training on how to read and leverage these reports and this data to create the interventions for their clients. Today, I'm really just going to be showing you some of the data that you can use to track and report on. So the summary report is here. And I'm going to open that up and you'll see that here. So this is a demo client. The Healthy Eating Index score, the HEI score, this is valid. It's a validated tool used in research for 2 decades, more than 2 decades. And the HEI score is based on the dietary guidelines for Americans. So it is it's based on that 2020 to 2025, but we will soon have 2025 to 2030. That's what the HEI score is. Now, we get a lot of questions from practitioners like, what if I don't necessarily follow to a T the dietary guidelines for Americans? That's fine. Like, this is not a judgment space. This is just data. So I want to stress that this is just data. You do with it as the practitioner. You are going to do with it as you feel appropriate for your practice and for your referring partners and your programs. But again, really, really powerful tool. And the goal here is not to say, okay, patient X, you scored a 54, right? It's not good or bad. It is just data. So you have a 54. Wow. Tons of ways that we can improve this score, and that's great news. So really just very positive, non-judgmental. If you work in the space of eating disorders, you're probably not going to be issuing these scores or having your clients do these assessments. But for everybody else, it's very appropriate. So it gives you data on eating patterns for fruit, vegetables, and whole grains. And it also gives you data on different nutrients. So if this were a client of mine, there are a couple of areas that I see where I, as a practitioner, can have an immediate impact. And it's all the reds, right? So the eating patterns for fruits, vegetables, and whole grains. And then fiber and saturated fat. Now, there are multiple intake diagnoses that I could assign using PES statements that I could assign to this client, but I need to prioritize. You're not going to tack everything at once. However, if I'm looking at a fiber intake, their average intake was 16.8 grams per day. That needs to go up, right? If I focus on the fiber, kind of the fruit, vegetables, and whole grains may improve and take care of themselves automatically, right? Maybe for this particular client, the saturated fat wasn't necessarily, a priority diagnosis. But again, if I'm focusing on fiber and eating more plants, that also might take care of itself. So for me as a practitioner, I'm kind of looking at this overall client scores and I'm saying, boom, fiber, that's what I'm going to focus on. That is data, right? So data here, you have all of this, biometric data on the side here, but this is like the nutrition and the intake data, which again is notoriously difficult to kind of track and maintain. Now it's easy. Get the score, write it down. This client has, when they started working with me, 54 HEI score, showed deficiencies in eating patterns for fruit, vegetables, whole grains, fiber, and saturated fat, other things that we could also, pay attention to. But the focus is going to be fiber. Intake of fiber, 16.8. The goal is this, whatever the goal is for that client. Again, 25 to 30 grams, but maybe in your practice, you really like your clients to target maybe 45 grams of fiber or even a little bit higher. Again, it depends. Now, this is a really good example, by the way, of how you can use this data like for different prescriptions. So let's say you have somebody who has active IBD, right? They're going to be eating a lower fiber diet, so a low residue diet. So this data is still helpful, right? Oh, I see, you're currently, your current intake for the past 90 days has been 16. Maybe we need to lower that, right? Or maybe they're in remission. Maybe we need to higher it. So again, just data. You are going to use it for your practice as you see fit. So that is just one of the reports. You can see, I'm going to go back to this here. I'm going to do the feedback report because I think that's really great too. There's a lot of information there, a lot of numbers. Here we go. We're back to here. Same HEI score. That did not change. It uses the same report, the same input, so the same assessment to generate different reports. So, this data is not going to change up here. And then down here, it really just extends it. It just expands it into more behavior nudges. So let's take a look at whole grains, for example, right? Their score was 3.3, data. The goal is 10, data. Now, these are behaviors that we can measure, right? So we're going to recommend, let's say the client agrees, right, that they can consume cooked whole grain cereals, which they're currently not consuming. The recommendation is 1 cup once per week. So that could be half a cup, across two different meals per week. Data, right? The client is going to consume half a cup twice a week of cooked oatmeal or cooked quinoa. HEI impact, 0.8. I don't know that I would necessarily use that, but I keep my eye on that data point, right? So the data points on this report, HEI score, all of these data points, right? We're just going to go down to whole grains. We're going to focus on that. 3.3, goal is to get it closer to 10. And what we're going to focus on is consuming half a cup twice per week of cooked whole grains. Is that making sense? I know I'm throwing a lot of, when we're talking data, it's a lot. So just comment if you would for me that makes sense. And then we'll continue to move forward. And if you have any questions about what I'm covering right now, please feel free to reach out to me in the comments, and Molly and Hillary will let me know. And Hillary, if there's anybody in the Facebook group who's asking questions, please feel free to post them here because I actually can see them. So it's great. All right, so this is the food feedback report, tons of data there. And again, I'm going to share this tab again. I'm not going to go into all these reports, but lots of data, things on, other nutrients like omega-3, omega-6. So if you're a functional nutrition practitioner, or if you wanted to take a look at, total caloric intake, that's all here. All of that information is here. So BioScreen is going to be and we'll build this into the report template that I'm going to create for you. And then all you'll have to do, I'll point you in the right direction, and then you can just fill in the blanks, which will be really, really helpful. All right. So let's go back here to quantifying outcomes that you can track. So HEI scores, really low-hanging fruit, no sweat off your back. You just issue the assessment. It comes back, you go into the report, you pull that data, right? You can even have your practice manager, if you have a VA supporting you in your practice, have them pull the data, get it on paper, and then load those reports into that person's folder. Confidence scores, a Likert score. So I'm actually going to go, you know what, I'm going to show it on the next few pages, but let's go into Living Plate RX, and I'll show you what that looks like. So a Likert scale it's just a scale from like 1 to 5 or 1 to 10. 1 to 5 has always worked really well for me in my practice. But sometimes people think 1 is better than 5. So you just have to be super, super clear when you're creating your Likert scales. For our members, we create them for you. And actually, yeah, so they are in the course, in your course section. You can go to your course selections. Let's just go to nutrition and heart health, and you can see that we have knowledge checks, which collects data. And then we also have Likert scales that look like this. I'm going to skip ahead a few. Oh, here we go. So you can see this here. This is a perfect example of what a Likert scale looks like. You can see I have strongly agree, agree, neither, disagree, or strongly disagree. So this was not even 5 to 1 or 1 to 5. I made it really, really simple. And this is for an in-person event. Let me just make sure I'm showing the right thing. Yeah. So this right here is for an in-person event, and where I literally just had them check it off. And then the report going back, let's say we had 50 people complete this evaluation. We track that. So, 95% of the people who attended this session agreed that they're able to identify PCOS supportive foods. This was for a PCOS presentation. 95% of people strongly agree. So that's how you take data that's just like a little bit softer, not quite like an HEI score, and you convert it to hard data, to numbers. So you take a look at, for this one question, what was the span here? Did they strongly agree, or did they strongly disagree, or something in the middle? And then you can say, sometimes if we got a lot of people in strongly agree and agree, I would report both of those as 1. So 95% of the people who attended, now you already told them how many people attended, right? So 95% of the people who attended this presentation either strongly agree or agree that they are now able to identify PCOS supportive foods. And, you can report the other data too if you want. I am very happy to say that we rarely got anybody who was, they disagreed or strongly disagreed, because we created evidence-based program that was really targeted at changing all of these results, right? Like getting these results for clients. So hopefully, if you're using Living Plate RX materials and you're facilitating evidence-based programming, most of your people are going to end up in the strongly agree and agree. So you're just going to decide what you're going to be measuring. What are the results? So it could be confidence. Like, think about things that they could agree or disagree with, right? Are you more confident that you can identify foods? Are you more confident that you can shop for them? Like, did you help them create shopping lists? Are you more confident that you can prepare PCOS supportive foods, right? So you can, it's really, I love the confidence scales, because that can easily be translated into positive health outcomes. If somebody is more confident about doing all of those things, they're more likely to get a better health outcome. Any questions on that, on a Likert scale? But that's kind of what it looks like. And then there are harder measures versus like the confidence down here. I'm just looking up here where, it says, it's asking questions here. It's really small here, so sorry. It asks questions related, like specifically related to the presentation. So let's go into our nutrition and heart health, because we have that built for you. So this is a presentation, could be delivered all at once, or it could be delivered over the course of 4 different sessions. But here's a knowledge check. Which is considered bad cholesterol? Reducing intake of unsaturated fats is the best way to reduce cholesterol levels. True or false? Go on to the next. We're providing you with all of these knowledge check questions. Now, if it is an on-the-ground program, you can just print this, brand it, of course, first, and print it and have people just answer the questions. Or you can build a form inside of your EHR. or if you're doing a course, you can build a form inside of your course so that they can just check it. But we provide you with all of the answers to the questions that are within that particular module. So for those of you who are Living Plate RX members, you really never have to create a knowledge check for any program that you use in Living Plate, because we provide that to you. For those of you that are not members yet, when you create a program, you're just going to go back to your objectives, your behavior objectives. You're going to take a look at those. That's what you have to measure, right? Your objectives, that's what you need to measure. If you're targeting to change certain things and get certain results, then those are the things that you have to measure. So typical things that you would measure is knowledge and confidence, but there are other things as well that you can measure there too. But we do all of that for you. So let's go back here. I'm going to share this tab instead. Go back to our confidence score. So that's how you use a Likert scale, and you can layer a Likert scale, and you can include a Likert scale on top of general information. Now, when I'm asking somebody a question about a course I delivered or a program I delivered, I tend to make it pretty easy, right? Because if they hear it from you or they hear it from me, and then they see it on the paper and then they write it down, they're going to remember it. The idea is not to like test them, right? It's not getting, oh, you only got 80% of those right. But it's really more to have the information stick, right? So if they're hearing it, they're seeing it, you're asking them the question, they're writing it down, they're more likely to remember it. And for me, that's always the goal. It's not always about, did they learn the hard thing? It's really about, is it going to stick? Right. And so if they answer incorrectly, then you can provide them with the correct answer. I did that in the digital courses. I would never say, oh, you got 80%, try again. It was like, you got this one wrong, but this is the right answer. Right. So the idea is just so that it sticks. Okay. So that's a Likert scale. Let me just come back here and see if we had any questions. Okay. We're all good. Perfect. Okay. So where am I? I'm back on here. Okay. So session completion rate, easy, right? So if you are doing a 3-month program, what percentage of the people that came to you completed the 3-month program? If the client came to you and you take insurance and they only have 3 sessions, they completed the 3 sessions. So 80% of the clients that you send to me come for all 3 sessions. Now, that's good for you because that's good business, right? Because that's the revenue, but it's also really important and says a lot to the referring practitioner or the referring partner about who you are and how you show up for people, right? If they keep coming back, that means that they're satisfied. If they show up once and they don't come back, you have to rethink how you're delivering care. All right, so nutrition behavior changes that you want to track. We're going to move through this now pretty quickly because I already showed you this report here, right? So increased fruit and vegetable intake. You are going to be able to see that in your BioScreen reports because it shows you the 90-day look back of their fruit and vegetable intake and whole grains too. And then you're going to retest them 90 days later. I love that because, it takes a long time to change behavior. Measuring them at 30 days could be good to kind of see if they're heading in the right direction, but the validity of this assessment will be at 90 days. So it kind of sets you up really nicely for a program because the data you're collecting before and the data after, it's 90 days, right? So you're going to want to measure nutrition behavior changes. You can measure it kind of all along the way, but really that 90-day mark is going to be that golden egg, right? Increased fruit and vegetable intake, more consistent meal patterns. Are inside of our library, we have a kind of meal behavior survey, so you can have people retake that if you want and report that data. Reduced intake of sugary beverage consumption, right? That's a big one. That's going to show up on the Healthy Eating Index reports. But you could also ask people, patient reported that they had been consuming sugar sweetened beverages every day, and now they're drinking unsweetened iced tea. So that went from, 7 a week to 0, which is great. So always thinking about the data. Goal achievement. All right. Love this. I love my goal achievement surveys. So let's take a look at them. All right. The reason why I love goal achievement surveys, let's just come to hello here for a second. I'm just going to make myself a little bit bigger. Motivational interviewing for nutrition practitioners is everything. I can't stress that enough, that using motivational interviewing in your sessions just makes your life easier. It makes the patient feel heard, and it's just overall really, really good evidence-based practice. But motivational interviewing can also really support you with collecting data. And I'm going to give you one example before I go into the goal achievement survey, because it's another way that you can collect data. This was data I collected when I was in practice. In my counseling room, I was going to show it to you today, but I couldn't get into my office. In my counseling room, I had a ruler. It was just like, just a piece of paper like this that I laminated. And it was on a scale of 1 to 10. And I would just simply hold it up. And I would ask my clients anything that I wanted to get a measure of, I would apply it to that scale. And this is a part of motivational interviewing, right? And this is how you can not only measure somebody's confidence, but you can really bring out, we use it in motivational interviewing to bring up barriers. I'm going to give you an example. So let's say somebody needs to increase their fiber intake. And so they need to increase their intake of plants, right? So there are certain things that they may or may not like based on the counseling. You're going to do all that intake, but, let's just say they're not crazy about, they eat processed cereals in the morning and you really want to move them now. Remember that half a cup of cooked whole grains per week. You want them to consume that twice per week. All right. So we've used our HEI score. We used our HEI data. Now we've got the patient in front of us and now we need to make sure that they can do it. Like, we need to support them with actually consuming that. So you hold up the scale. On a scale of 1 to 10, how confident are you that you can prepare 2 half-cup servings of oatmeal per week in the way of overnight oats or cooked oatmeal? How confident are you that you can accomplish that? The answer is going to tell you everything. Some people might say, a 10. Great. Write it down, report it. Patient's confident that they can do that. You give them the recipes, off they go, right? No barrier to them meeting that goal. But what if your patient says to you, I don't know, 6. I got 6 a lot, like 5 and 6. People's culinary confidence isn't great. So 5 or 6. Okay, Mary, tell me, why is it a 6 and not a 10, right? Why are you not totally confident? The answer to that question, so you're getting the data. She's a 6. You want to get her to like a 9 or a 10. What can you do as a practitioner to change that data? What are you going to do about it? What you're going to do about it is you're going to listen first. You're going to hear, what are the barriers? So Mary might not be super comfortable in the kitchen. She's like, I don't even know. Like, I haven't eaten oatmeal since I was 5. I don't know how to cook it. Okay, I got you, Mary. So how about I have a video for overnight oats, 6 ingredients, really easy. And I have a recipe. What do you think? Look at these. What do you think? What is your confidence now that you can do it? Oh, like maybe an 8. Okay. So they're now moving along. They go home with their resources to help them break down those barriers. They have you as support. They come back. You have a number. Now tell me, how confident are you? How'd it go? Oh, that was easy. Great. 10. Perfect. You bank that data. You move on to the next. So those, using motivational interviewing is a really great way to, of course, to support your patients, but it's a really great way to collect data. Use a scale on a scale of 1 to 10. How confident are you that you could walk into the grocery store and identify high fiber foods? The answer will tell you everything. If they're not confident, you need to provide them resources from inside of your Living Plate RX library that will support them with breaking down those barriers so that they get to the 10. So bank the data, look at what the delta is, right, from 6 to 10, and identify what can you do to change that. So it's so much more, Molly, I know I'm going off the rails here a little bit, but it is sometimes so much more than just the data, right? Because these are people. And the reason why you're collecting this data is to move them from, a 6 to a 10. And that's how you do it. You systematize it. You make it really easy on yourself. So I always felt like having that ruler in the counseling room just reminded me to use it, to ask the question, to show the clients, and then, record the data. All right. Okay. So Molly's saying this is gold. Okay, good. All right. So let me share the screen again. All right. So now I want to move on to goal achievement surveys. And again, the goal achievement survey and the goal setting, that reminded me about motivational interviewing a lot. So I'm on lesson 2. Here's a goal achievement survey. Now we're going to go, before I show you that, we're going to go back to the goal setting survey, which is in lesson 1. So if you are moving someone through a program, you're going to want to measure their progress at every step, right? So your HEI score, that's kind of long-term data that you're collecting. Your Likert scales and your scales of 1 to 10, In the office, that's more shorter term, right? These are things that you can support them with changing pretty quickly. But the goal setting and the goal achievement, like that moves pretty quickly, and it really depends on how often you're seeing your client. At the end of every session, or at the end of every lesson, or the end of every program, let's say you're doing an 8-week employee wellness program, which was something that we did in our practice. Let's say you're doing an employee wellness program. Everybody in that room needs to set a goal, at least one goal, optimally 3, before we meet next. Like, what are you going to do? Think about what your confidence levels are. What are you going to do before we meet next? And it has to be a SMART goal. And so we support our members with goal setting sheets. If you are not a member, this information is available on the internet. You can create this yourself, but members, we give this to you. So we support you with collecting this kind of data, right? So this is a SMART goals map: specific, measurable, achievable, relevant, and timed, like all the SMART goals kind of rules. And then you're going to collect this. You're going to have the patient, input their goals, and then you can collect it. For larger group programs, I actually didn't collect it. And I made it anonymous on purpose because I just wanted them to set the goals and then self-report back. But for individual clients, you can absolutely collect the data and talk about it and put it in their EHR folder. So what are your goals? And we'll go back to, I will prepare 2 breakfasts. Each are going to have half a cup of whole grains in it before the end of this week, or before we meet the next time. Or even more specific, I'm going to prepare the 2 recipes that you gave me before the end of this week. So just really specific. It has to be really achievable. Maybe your client can only do 1 goal. Maybe your client only wants to make it 1 time before they meet you next, whatever it is. It doesn't matter. It's just a starting point, right? It's a point in time and it's data. So write the goals, and they should have a target date for completion, so that when they come back and they're in front of you, that's when you hit the goal achievement survey. So again, you can't change what you can't measure. So if you're just collecting goals, but you're not following up on it, it's not going to be a good measure. You need to round back to them in a motivational interviewing way, which we're going to talk about now, with a goal achievement survey. So I met my SMART goals from the last session. Yes, no, or some of them. If you're doing a group program, you can consolidate this data. 95% of the people in this program met their SMART goals every week, right? That's how you, again, translate it into numbers. Use percentages for these kinds of measures. So did they meet it? Didn't they? Or, some of them. Now, this is the motivational interviewing piece, which we're not going to go into a ton, but it's worth mentioning because you're looking at it. If you did not meet all of your goals, tell us why, right? So if Mary committed to making half a cup of whole grains twice per week, she's going to come back and either report, yes, she was able to meet them, or she didn't. Now, if she didn't, the question is why? Tell me why. And it's going to be another barrier that it's your responsibility to bust down, right? We're barrier busters. So you're going to get another barrier. Oh, I didn't like the texture of the oatmeal. How about that? Or, my husband didn't like the texture, whatever. So let's just use texture as one of the barriers. Oh, I have a solution for that. What I want you to do is keep the SMART goal, keep it the same. But now I want you to use quick cook oats instead of old-fashioned oats, right? Because we all know the difference there, right? Some people like it chewy, some people like it mushy, some people like it wet, some people like it dry. So, just explore that and then go back and reset the goal. The point here is that you need to measure the goal and you need to follow up if they met the goal or not. Is that making sense? We're all good? Okay, great. So goal achievement, I'm going to come back to self-report. So for our members, you're going to find all of the goal achievement survey and the SMART goals sheets. That is, they're standalones, but they're also in every course inside of your library. So you can go there and grab them. Okay, so self-reported outcomes: energy levels, digestive symptom improvements, sleep or stress improvements. That's softer data. That is going to be inside of patient charts generally. So self-reported outcomes are generally going to be kind of your one-to-one or small group, but you can still quantify that data by saying 95% of the people who come to see me report better energy levels. Right? I sound like an ad on TV, right? But that's a good lesson. That's what they do, right? They take these percentages and they make them work for their business. So self-reported outcomes can be aggregated and reported as well. And you will see trends that you probably, if you've been in practice for like 3 months or more, you're going to see trends of progress, and that's what you want to document. And then like a satisfaction score, that's always great too. Like how satisfied were you with the program? And again, the strongly agree, strongly disagree, you can make some assumptions there. If somebody responds strongly agree or agree to all of your Likert scale questions, they are very satisfied, right? So you can either ask them a question, how satisfied were you with this program from 1 to 10? You can quantify it that way, or you can kind of draw out those numbers yourself. And then how likely are you to recommend our services or this program? That's always really good too. Let me show you. I wanted to expand this part too. So this was the more of the qualitative data, right? So if you go to the end here, likelihood to recommend, yes or a no, but then collecting some qualitative data, it could be really great too. So why that data matters. Number one, it brings kind of the humanness to the story. It can be more specific. So, and it's also going to be very specific to your niche. So if your clients or the people that are being referred to you, like their number one concern is digestive distress or constipation, like they're not going to want to hear about anything but that. So you're going to want to bring human stories and numbers that speak directly to what the primary concern is of people coming to you. So always think about that when you're kind of digging for the data. So the qualitative data makes it more human, helps providers kind of connect the real impact to people. And it just adds another dimension to your report. So these are just kind of some sample qualitative measures. Clients report feeling more confident in shopping and cooking for their family for the first time. Client had reduced emotional episodes. And in this too, you can put in some quantitative data as well. So always like the client self-reports. Those are always really good for the qualitative kind of feedback for your referring practitioners. The referred client shared she now has energy to walk her dog daily after lunch. Big win, right? But again, qualitative. Where can you collect this qualitative data? Well, could be an email, which is great, right? Like if clients send you an email or an EHR saying, I have never felt better in years, right? If somebody's really struggling with constipation and they've been so uncomfortable, like, yes, you're going to report other things, right? Like how many bowel movements are they having now within the course of 3 days, but also like, how do they feel? Oh my gosh, I feel less bloated. I have more energy. That's all really great. So you're going to get those inside of your EHR. You're going to be documenting that. You can pull that out. But here's a way that you can collect qualitative wins in like group programs. Just ask the question. Do you have any recommendations or comments for me? And I always included that in the bottom of my surveys for in-person group programming. They were almost always complete. Sometimes it was just like, great program, can't wait to do it next. Or I never tried quinoa. I'm really surprised by how much I liked it, right? Attendees reported never trying quinoa and now they like it. So you can take, individual reports here and kind of look at trends and then make it a generalized statement for the qualitative data. So again, group comments, breakthroughs. Here's a great one. So if you're delivering like a live event or you're doing a webinar and people comment in Facebook or Instagram, like that's data, right? That's feedback. 95% of the people who, attended this webinar commented that it was, helped them transform their practice or really supported them with understanding PCOS, whatever, like that. You can find data anywhere. It's just a matter of, how do you actually report that? Okay. So let me go back to, are there any questions while we're still on? And we're wrapping it up here now. So let's go here. Oh, what am I sharing? I don't even know which tab I'm sharing now. Okay, we're back here inside of the library. So, as a summary, you can't change what you can't measure. So you have to find ways to measure things. Some things are easier. The HEI score, the BioScreen dietary assessment tool, available to all Living Plate RX members. It is a $200 annual value included in your membership. So for anybody who wants access to that and so much more, like everything else that you're looking at here, all of the different kinds of content, reach out to us. We are going to be posting a link here. We'll also post it in LinkedIn, YouTube, and in the Facebook group. If you're not a member yet and you want to kind of take a deeper dive into anything we talked about today, here, I'm actually just going to come to hello now because we're wrapping up. There we go. Hi. If you wanted to take a deeper dive into anything that we talked about today, or if you need support with using these tools in practice, join a demo call. So on our demo call, I'm going to cover with you. Actually, let me come here. Here we go. Oh, here we go. I'm going to restart this. Here we go. Can you guys see this? I think you can. I'm just go to the end here and just share with you on the demo call kind of what we'll go through. So if you have not become a member of Living Plate RX, you can join a demo call. So I'd love for you to click the link that we're going to be dropping here, join a demo call, and I will take you even further into the library to kind of show you how all of these resources work to change the data. Like the reason why we thought having this Q&A was so important was because you need, from a value proposition, you need to show data. You need to show where people start and where they finish. And everything that happens in between is a lot of work. You need a lot of resources. You need a lot of content. You need a lot of support in order to get your clients from a certain data set to another data set, really. And that's really what Living Plate RX is all about. So everything that we provide you, and I just pulled up this slide because I thought it would be helpful to guide the conversation. Everything in our library is going to help you change that data to get better positive health outcomes. Everything is evidence-based, totally customizable. So it doesn't matter what your niche is, your brand, you get to customize it. It's white labeled. Everything is really easy to use. Your focus is on changing those data sets from beginning to end for clients. Our focus is to help you, make that happen inside of the counseling room. And so we make it really easy for you to use the materials and the digital meal planner, very scalable. So like as you grow, you're still, whether it's larger data sets or just more clients, you're looking at a lot of different data sets. It's going to be really easy to kind of repurpose and reuse a lot of the content for different clients and different programs. And it's very scalable. We help you with how do I do this for larger programs? Well, we support you with that. So really have a big focus on that because you're not in a hobby, right? You're in a business and you need to grow. And so we always have to keep in mind, like, how do we help you scale? We're always expanding. So every month we have content that is dropped into the library. And yeah, a lot of that content right now is being driven by our members who are all they're all practitioners. So they're either dietitians or other healthcare professionals. We also have a body of health coaches using our health coach library. Everybody tells us what they want. Everybody's really noisy. They're just great. Like, we love hearing from our community. Like, hey, I don't see this in the library. Could you create it? The answer is yes. The answer is always yes. If it's evidence-based content, we will create it. So we're always expanding and we're always delivering huge value to you guys. And it's very, very affordable. Our membership is not cost prohibitive to anybody who is in business. And so whether you are a private practice RD or whether you're an outpatient clinical RD, we make it affordable for everyone because our goal is really just to improve the health of your communities. Oh, here we go. Perfect. To support you in improving the health of your communities, right? Changing those data sets. That's what we're looking to do on a large scale. And so we want to make sure that everybody can get access to this. So book your demo call, join me and my team, and we'll take you for a deep dive into the library and really show you what it's all about. Molly, Hillary, was there anything else that you wanted us to go over today? I think that we've wrapped up the conversation. I think everybody understands now. We answered all those questions of, how are you going to be showing your value and quantifying let's go back to the beginning here. Let me hear. And we'll just cover our objectives, make sure that we got them all. Let's go here. Here we go. Back to the beginning here. So made sure that how do I present outcomes for referral partners? Already covered that. You're going to want to collect your data, use your reports, and potentially an executive summary. How do you translate the I feel better? We talked about scales. We talked about Likert scales. How do you convert that into measurable outcomes? HEI score, got that. And then how do I use these outcomes to justify my pricing and improve my marketing? Look, if you're getting enough people from point A to point B, your marketing, like your value is shown. And you just need to make sure that you can communicate that value to not only your partners, but your potential partners as well. All right, great. Thank you so much, everybody. Thank you for your patience as we struggled with the tech to go live. And I look forward to seeing you in 2 weeks for our next Q&A. Thank you so much. Have a great weekend.